I'm glad to be here today with you all in good health at the age of 91. It has been my vision for the past few years to sit here among this panel of accomplished speakers and hold a global roadmap, webinar, and roundtable to collaborate on discussions to accelerate the learning health system movement we started in the 2012 summit in Washington, the Joseph H. Kanter Family Foundation sponsored. I want to take a brief moment to share my gratitude for the speakers who have traveled here today in Miami. I want to point out each of the speakers' commitment to community and urgency by unifying our common interests, goals, accomplishments, and how to move forward together. Thank you to the individuals who signed up for the webinar. By listening in and submitting questions to support the speakers and spread the information you get today. The organizations and individuals represented here today globally who have come connected to the webinar and the speaker's information. It is one of our greatest accomplishments. Sharing information of the learning health system vision with other countries is my hope and dream. Josh Rubin volunteered his time together with my assistant Danielle Edwards in order to make this conference a success, and I would like to acknowledge their hard work and effort. Most importantly, I want to thank my family, starting with my wife Nancy, whom I've been married to for 62 years, my oldest son Harry, my eldest daughter Hillary, my daughter Mary, my son John, and his wife Stacy for their support today. It is my hope the accomplishments of the Kanter Family Foundation legacy will live on with my grandchildren, Alexandra, Matthew, and Emily, also Reed, Charlie, and their mother, Conroy. I will not be following too much the slides because what I have to say is that together we can develop the largest learning health system organization that is global and includes the developers of software, producers of databases, doctors and patients who have diseases that have not been cured working together. I would like to see individuals who want to reform the healthcare system work together, and that supporting the free enterprise of transparency and competition in healthcare. We stress the urgency of moving rapidly and together to advance this LHS vision. Our nation cannot afford to wait until 2024 to do so. We can't afford to squander our opportunity to learn from increasingly electronically captured lifetime of health experience of the vast majority of Americans when causes of mortality like heart disease, cancer, and medical mistake take hundreds of thousands of American lives annually. We cannot afford to wait an average of 17 years for new research from bench to bedside. We cannot in good confidence fail to routinely how to empower the transformation of the health system. According to the 2012 Institute of Medicine study, the United States health system wastes more on unnecessary treatments and abuse and costs than our nation spends during a year on public education. We applaud ONC Office of the National Coordinator for finally recognizing that realizing the LHS vision needs to be our overreaching goal, and we cannot afford in dollars and lives to wait until 2024 to do so. For its leadership in mobilizing and empowering all stakeholders to transform our healthcare system into one that learns routinely and at scale, but urge an unrelenting sense of urgency in working to realize the LHS vision of a big, hairy, audacious goal. This is said to be too big a task for any one person, organization, or government. We can do this together collaboratively. My colleague Bob Brook of Rand Health and UCLA shares my frustrations. It is impossible, he states, it is possible for me to provide that information that patients want when they come to see me. It's absolutely impossible, even though I'd like to do it, as virtually all physicians would like to do it. It is estimated 80% of every doctor's recommendation are what the medical profession calls anecdotal. No randomized clinical scientific data. We simply cannot afford to wait any longer. For example, between today and tomorrow, while the participation in this webinar, roundtable discussions, and other activities aimed at accelerating our progress toward an LHS vision, 1,100 women will be diagnosed with prostate cancer. Because we still do not know what works best for every disease, for every patient, evidence suggests that 700 of these women will be given drugs that do not work for them. Our health system cannot operate this way. How many more lives need to be lost by the millions? How many more dollars need to be spent by the trillions? Our children and our nation deserve better, starting right now. For the past 2 decades, the mission of the Joseph H. Kanter Family Foundation has been the transformative vision forward. Some have told me that it couldn't be done, but that has never dissuaded me from trying. In fact, I've redoubled my efforts. But despite the pessimism, I'm challenged to develop 50 million electronic health records, which we call the Learning Health System. The culture has now changed. Before we couldn't do it attitude. To now, the attitude is we can do it. We are promoting the fact that the most important source in healthcare not utilized is the patients ourselves. After all, one day we will all be patients. The time for action is now. That action is urgently needed. 2 decades ago, I called for the creation of a health system that drew on the real-world health experience of millions of patients to be captured in electronic, computable form to empower researchers and ultimately clinicians and patients to know what works best for every patient, for every disease. The Learning Health community is one of the grassroots organizations formed from the Summit #1. My hope is that Global Webinar will build upon the work that began in 2012 at Summit #1 held in Washington, D.C. In 2012, because of your collaboration, the core values established from the LHS community is one of this important slides provided here for you to view. I would like to note that the committed organizations over the years since the summit have endorsed this set of values. As we work together, I would like to say to you, you need to ask yourself 2 related questions. What can I do? What can I do for a learning health system? What can a learning health system do for me? I propose that if doctors believe they are not ready to develop cures for patients now, then we start with learning hospitals. These learning hospitals would develop an LHS to produce cures in all diseases. And any doctor who is now ready can join this group. Learning hospitals will compete eventually with teaching hospitals. In conclusion, our mission is the collaborations of all individuals globally who want a better healthcare system and an optimal health for everyone. 2, to work together on the largest virtual organization supporting the LHS. No membership dues, minimum travel and travel expense. Collaboration and discussions will be held by webinar, emails, and phone conferences. Number 3, and most important, accelerate the production of cures for all diseases. I would appreciate if, and I won't, these words that I'm going to state will be the most important words that I say today. By working together on this mission, we can achieve the gift of health to our children, our nation, and the rest of the world. Thank you.